success, be nobleness, and every gain divine. And you know, when I was in school, we used to sing it something like this. Listen here. Oh, beautiful, far spacious skies, far amber waves of grain, far purple mountain.
We will have our welcome by Ms. Marge Clemens, Chair ADA.
Good afternoon, ladies and gentlemen. My name is Ms. Marge Clemens. I am the presiding chair for the Disability Awareness Council of Orange County. It is my pleasure to welcome everyone to our beautiful event this afternoon, Living Through COVID-19 and Having Disability.
So now we will have our introduction by Dr. Timothy Miles, Program Manager.
Hello, everyone, and welcome again to Living Through COVID-19, a Vulnerable Population. The TDAC is celebrating the 30th ADA anniversary of the American with Disabilities Act. The Americans with Disabilities Act, better known as ADA, is the most comprehensive federal civil rights statute protecting the rights of people with disability. It affects access to employment, state and local government programs and services, access to places of public accommodation, such as businesses, transportation, and nonprofit service providers, as well as telecommunications. As many of us know, the ADA has 5 components. Number 1 is employment. Number 2 is state and local governments. Number 3 is public accommodations. Number 4 is telecommunications. And very important to us all is number 5, miscellaneous, which the key point is enforcement and who enforces those laws when they're violated.
So now we will have our speaker, Quintana Stewart, MPA.
Good afternoon. Happy anniversary. 30 years is no small accomplishment. So kudos and congratulations. The work that you all do is so very important. And I have to say, in the midst of this coronavirus pandemic, the work that you do has been highlighted for me and my team on a daily basis. So I guess I'll start out this conversation this afternoon the way I'm starting most presentations or talks these days. I'll just share a little bit of data about what COVID-19 looks like for us here in Orange County. And then I'm going to talk through and just share some of the things that the health department and some of our other community partners are doing in response to the pandemic. And then I'll just turn it over back to you guys for question and answers, if that's okay. So as of today, in North Carolina, we have a total of 162,491 lab confirmed COVID-19 cases. We've seen a total of 2,652 deaths. Here in Orange County, we now have 2,170 confirmed COVID-19 cases, and we now see 50 deaths total since this pandemic started back in March. The bulk of our cases right now, no surprise, excuse me, right now the bulk of our cases are being seen in the age group from age 18 to 24. They make up 45% of our cases as of today. So that's almost half of our COVID-19 cases right now in the county. Being a college town and with the reopening of university, again, that's it's not good news, but it's not a surprise to us either. Right now, you may hear in the media we talk a lot about the positivity rate, the percent positive. Our percent positive in North Carolina as a state is 6.9%. Here in Orange County, our percent positive has increased to 10.3%. So the percent positive really tells us, how the virus is moving and how the transmission is taking place in our community. Ideally, you would like for your percent positive rate to be 5% or lower. We had achieved that a couple of weeks ago, and now we've had this huge spike, and we're now up to 10.3%. So that means out of all the tests that we've given in the county, about 10.3% of those tests are coming back with a positive result. We currently have 3 outbreaks in our county. And so an outbreak would be 2 or more confirmed cases, and it shows that there is sustained transmission in one setting, one facility. So right now we have 3 nursing homes that are in outbreak status, 2 of our residential care facilities, and then we had 1 small outbreak in the county jail. Happy to report that we do have a strike team in place. And so the strike team consists of a nurse from the health department, a chemical disease nurse, community paramedics from our EMS department, and some other staff. We also have a firefighter that helps out with this group. But the strike team, they go out to all the long-term care facilities in our community. They do assessments, they offer training for staff. They talk to staff about disinfecting, wiping down the facility, how to manage patients whenever you have a positive. So they do lots of cohorting. So if you have 1 or 2 positive patients, you want to put them like on the same hall, and you want to separate all your negative patients in an effort to slow the spread of the virus. So our strike team has been really busy since the beginning of this pandemic, and they continue to go out on a regular basis, again, to assess health facilities, train on proper use of personal protective equipment or PPE. So that would be their masks, their gowns, how often they should be changing their gloves, those types of things. So that has proven to be really beneficial and helpful. And I have really enjoyed the relationships that I've seen come out of this with our long-term care facilities that I know we probably would not have had otherwise. We have a very robust county website, and this is really like the hub of all of our information here in the county related to coronavirus. The website is orangecounty.gov/2332/COVID/19. So our website, again, this is where you can go to find any and everything going on in the county related to coronavirus. We have several blocks and links up for many resources. One is a food resource tab. We have one for housing and utilities. We have one for mental health services. We have one for places of worship that are interested in now, coming back together to worship, but they want to do it safely. We have one for our businesses. It's just chock full of information and tons of resources. And I have to say, in all things that we do from the department, we are always trying to do it from our equity lens. We have been very active and heavily involved in doing equity work. So the department does not discriminate on the basis of age, race, color, disability, national origin, or sex. We are adamant about that. And so we allow equity to kind of drive all of our plans and activities that we do. And with this virus, this pandemic, again, it has really pushed us and made us stretch ourselves to think about how we offering our services. Are they equitable, and are they accessible to all? So some of the things that have come out of the pandemic as a result, and some changes for how we operate. Again, using our equity lens, we want to make sure things are accessible. So the goal is to remove those barriers. So one thing that's new for us as a result of the pandemic is our clinics. We now offer the telehealth appointments because we understand that, many folks are safer at home, and we also don't want folks coming out into the community, potentially been exposed to the virus if they don't have to. So we've now set up and we've started implementing telehealth appointments, so we can do it over the phone or via another device if you have that. So that's new for us. The other thing we've also started doing is we're trying to pick up on our testing, the COVID-19 testing. I was out at a testing site this morning. And so, you know, we understand that drive-through testing is a good thing and it makes it more accessible to many folks. But we also offer some walk-up testing if it's in a community where folks may not have a personal vehicle and they're not able to come out and use the drive-through model. And then just as of last week, we received additional resources from Department of Health and Human Services at the state for additional testing services. So at this time, if you all have an organization or you know of a place that needs some COVID-19 testing, reach out to us because we will be able to come out to you if folks aren't able to come out to some of the community testing sites that we have set up. Other things that we do, thinking through equity, almost all of our information on that website, we translate into the 6 different languages that are spoken throughout the community. So we're mindful of that and we try to make it accessible. And we don't want, you know, language to be a barrier to getting the information. I have to say when it comes to testing, another event related to testing, and if anybody on the call has had the experience of testing positive, or you have a family member or a loved one that has tested positive, you likely got a call from some of our staff as we do our contact tracing and investigation. And so the purpose of that is, again, we're trying to slow the spread as much as we can. So if we have someone that tests positive, we will call them to talk and try to figure out their movement, their whereabouts, and any close contacts that they've been around in the last couple of days prior to their testing. Again, the effort is to let people know and to have people quarantine, stay at home, or for those that may need testing, we want to work with them and make sure they can come in and get their tests. When we get this information, we gather it, it is private, absolutely, 100% private. We've had, especially with the return of students, some fear and folks concerned that they're going to get, you know, a friend in trouble. But that is not the case at all. Again, our only goal is to reach out to the person, make sure that they understand that they were potentially exposed, and we want to get them services that they need so they maintain their health. So we honor the privacy of all individuals, and we never share any of that information. And so that's something that I've heard a lot of folks talk about. During this pandemic, there's fear. Lots of our community members are afraid. This is a novel virus, it's new. To date, we still don't have a vaccine. So folks are afraid.
Oh, there is a question in here. Brennan Booma says, what is the relative risk of airborne transmission versus on surfaces?
Hi, Brennan. Great question. And as much as I understand it, and I will admit I'm a little bit behind on some of my reading, but there's still some unknown about that. However, I will say that the science is pretty strong, and there's something to this airborne transmission because the masks work whenever we wear them. But I also believe it is important for us to wipe down and disinfect, you know, frequently touch surfaces often, because you just think if you're at home, like now I'm in the office, but I'm the only person in my office, so I don't wear the mask when I'm in the office. However, before I leave, I'm still going to wipe down my workstation because I realize other staff may have to come in here and get something, and I don't want to have droplets or anything on these surfaces, and then they come behind me and they touch it. So it is still just as important to wipe down and disinfect the frequently touched surfaces, as well as wearing your mask to prevent some of the droplets and maybe some airborne transmission, if that in fact is valid.
I would like to ask a question. What type of mask do you think is strong to use?
So the ones that well, if you're working in a healthcare setting and you're doing any type of procedure and there's some type of aerosolization that could happen as a result of that, then we really encourage you to wear a N95 respirator. And those are the ones you have to be fit tested for, and they ensure that you can't smell and taste things, and so it's a very secure fitting. For average community members out day to day, and this is what I'm wearing, but I have a cloth face covering that I wear. I have several actually, get through the week until I do laundry. But you want a fabric that's not too loose. You want to be able to breathe, but you want one that has a pretty good thread count. But these are also, they're just as effective for going out to the store and then coming back home, not doing any kind of healthcare or medical procedure. They also have the surgical masks, and they're back in good supply and stock now. You can find them out at all the drugstores and at Walmart. And I also have some of those that I will wear, but they too also work, the surgical masks.
Thank you.
Mm-hmm.
I actually have a question of my own.
Mhm.
What is, so we talked about the test positivity rate. How do they calculate something closer to what the actual positivity rate out in the general population is? Because I've heard that, or I guess that the test positivity rate would be higher than that because people are more likely to get a test if they feel sick.
That is correct. And as we've learned over the last month or so, we have a high number of asymptomatic folks walking around. So they have no symptoms. And so there's nothing that would trigger them to go take a test. And so I agree that I believe our percent positivity rate probably is actually higher than what we're calculating. But all we have right now is we can only take the calculation based on the number of tests that we've conducted. So during some of these recent